Hi, I'm Marie Talti, President and CEO at the Partnership for Maternal Child Health of Northern New Jersey. Thank you for joining us as we discuss the New Jersey Healthcare Quality Institute's Maternal Action Plan. The plan, which complements the Nurture New Jersey strategic plan, outlines 4 specific areas to improve maternal health care in New Jersey. Today, we're going to be discussing part 2, the role of data collection to improving quality and equity. I have with me today Kimberly Seals-Allers, who is founder of Birth. B is missing, it is birth, but B is missing for bias. And then we also have with us Linda Sloan-Locke, who is a midwife and maternal child expert. So we understand how important data is to changing the landscape and improving maternal mortality and morbidity. So for our conversation today, we're going to focus on the qualitative data and the patient experience and how that is going to be able to be changed and overcoming bias within the system. So we're going to start with Kimberly. How are you today?
I'm doing well, thank you. And thank you so much for including me in this important conversation.
Absolutely. So can you please introduce yourself, and then Linda will introduce herself.
Okay, thank you so much. My name is Kimberly Seals-Allers. I am the Executive Director of Narrative Nation, which is a New York City-based nonprofit that creates multimedia and technology platforms that are all narrative-centered to really address racial disparities in maternal and infant health. And as you mentioned, I am the founder of Earth, which is like the word birth, but we dropped the B for bias, which is the first of its kind Yelp-like review and rating platform for Black and brown women and birthing people to find and leave reviews of their OBGYNs, birthing hospitals, and pediatricians. We are all about capturing, using a consumer-oriented tool to capture qualitative data, and then we work directly with hospitals, payers, and providers on the back end to turn our Black patient experience database into actionable strategy plans for hospitals and other providers. So excited to be a part of this conversation today. I look forward to engaging and sharing some of our insights.
I said very important. Thank you so much. Linda?
Hi, good afternoon, everyone. Thanks so much for having me, Marie Carl. My name is Linda Sloan-Locke. I'm a midwife and social worker. I've been working with women, teenagers, and birthing people in the state of New Jersey for over 40 years. That's kind of all I'll admit to. And I am currently not catching babies anymore, but I'm really active in the field working on quality measures and ways to reduce or improve our outcomes for maternal health and infant health in the state of New Jersey. I work with the Perinatal Quality Collaborative and have been working with the Health Disparities Work Group of that organization, as well as the American College of Nurse Midwives, and being on the board of the Quality Institute. Also, I sit on New Jersey's Maternal Mortality Review Committee.
And this is why we have you as our maternal child expert. Thank you so much. So Linda, I'll start with you. We know how important data collection is in changing any narrative and any landscape. So can you talk specifically about data collection and the role it plays in maternal child health?
Sure, thanks. I'll just begin with a brief overview and then ask Kimberly to add more depth to that. So when we talk about data collection, traditionally, we've talked about numbers, right? We've talked about some of the things that we are very familiar with, we've become more familiar with in recent years are things like the maternal mortality rate, how many birthing people die either during pregnancy or at the time of birth or postpartum after giving birth. And those numbers really help providers, individual providers, hospital systems, payers to benchmark these outcomes, these numbers outcomes against best practices and against a standard point. So benchmarking is looking at how do I stack up to a standard point? And there are standard points that are set by organizations like the CDC's healthy people. So every 10 years, the CDC comes out with a healthy people 2020. We're now looking at healthy people 2030. And then they have, within those, they have benchmarks for a variety of health outcomes, such as cesarean section rates, breastfeeding rates. And that's a way that providers can look at how they match up with those benchmarks. Those benchmarks aren't the ideal, they are what we have identified as kind of the minimum, right? Not something to necessarily shoot for, but something to be better than. And so that's kind of like a brief overview of data. It kind of it can identify the areas where we're doing well, and also it can identify the areas that where we're not doing well, and so help us to identify where we need to put more efforts, and point to how we should be, well, not how, but that we have an area where we need to put more efforts.
We know the information that we get and the assessment that we make, the benchmarking and the tracking is only as good as the data that we collect, right? So what critical information does the patient experience and the experience of the family, what would we say, what information does that play in having the data collection? What's missing? What should we consider when we talk specifically about Black birthing families and their experience?
Well, first, there's some limits in the data, just the numbers that we get, right? So we know that the data is only as good as those folks that collect the data. So we know that we have points in data that are incomplete. We see this in the maternal mortality review. We have incomplete data so that we really don't have a full picture, even in the numbers. Before you get to the patient experience, just the numbers are not complete. Who's collecting the data? And that may vary among different institutions and different places. They may have different formats for how they go about collecting data. And so the data is not looking the same as it comes out of different organizations. There's not universal alignment of definitions even. Just the term maternal mortality, although the CDC says maternal mortality is a death that takes place during pregnancy, birth, and for a year after, there are some states that are still using 42 days after birth. So different organizations, even the March of Dimes has a different definition than the CDC. So that lack of alignment in numbers is a problem and leaves holes in the data. So that's just in the numbers piece. In the patient experience piece, I think it's interesting to note that we started off talking about patient satisfaction surveys, which kind of is a presumption that the patient is satisfied, not satisfied, right? And when we kind of think about that word satisfied. When you do any kind of assessment, satisfied is kind of in the middle, right? That's not the best. You know, it's either really bad or it's okay, or yeah, you were satisfied with it, but it wasn't excellent or outstanding. Right, so satisfied shouldn't be what we're looking to achieve. You know, we should be looking to achieve outstanding and excellent, right? And so reframing that to be the patient experience and looking at the full experience and then doing something with that information is a really key piece that we are now beginning to understand is so very essential, and where Kimberly can really give us more background and depth on that.
Absolutely, absolutely. We know that especially in nursing school, when we talk about statistics and quantitative and qualitative data, you know, the experience in pulling out those themes in qualitative research is just so very important. And I know back in the 70s, there was a patient experience survey done for laboring women, which made quite a bit of change in the procedures in labor and delivery. And that was all patient experience, all qualitative information. So, Kimberly, seeing that qualitative information can be, you know, quite a powerful tool that we have in our tool belt. What is Earth and how does it differ from different data collection tools? And how can that really make a difference in changing the paradigm?
Yeah, thank you. I mean, I would say that when we look at what's going on in data collection, as Linda was mentioning, when we're focused on clinical outcomes, when death or near death becomes the only benchmark, we're missing a whole spectrum of patient experience, which includes negative experiences that cause a lot of people, trauma, harm, feelings of disrespect that impact the rest of their healthcare journey. And when we're only looking at death or near death as a measure, then we're missing that whole spectrum. And so in our work, when we created Earth, we really wanted to focus on not what happened, because as mentioned, there are important benchmarks out there counting clinical outcomes, but how it happens, because we find that that is what is impacting Black birthing folks, not just in their birthing experiences, but their likelihood to access healthcare for the rest of their lives, right? It's a very vulnerable and really actionable time for us to make an impact. And so for our work of capturing robust Black patient experience reviews from not just mamas and birthing people, but also from fathers, we accept reviews from doulas and hospital-based midwives. I'm sad Linda's not gonna catch babies. And so that we can really bring this full spectrum perspective back to hospitals and providers, because to the point that was being made, what is a 5-star experience for Black and brown birthing people? Nobody knows. And until we start defining that, asking that, analyzing those, then we can create that and make that as part of the new standard, not just that we don't die or nearly die, but that we actually have a patient experience that makes us feel whole, complete, seen, respected, and dignified. And so that is really the work that we do with Earth, is how do we capture through a robust mechanism like an app that is in a consumer's hand that they can use at their own convenience, to capture this feedback, and then again, turn those anonymized reviews into data to work directly with hospitals, payers, and providers to inform them on what we can do to improve, right? What's going well, and what actually can make a 4 or 5-star experience for every Black and brown birthing person, because I'm sure we all agree that that's what they deserve.
Absolutely, 100%. So what I'm hearing is, just because I have gone to the hospital, labored, and left, quote unquote, unharmed, right? Benchmark, everything is checked. I left unharmed, whole person, does not mean that I had a stellar experience, right? So can you share with me the qualitative information that you receive from the surveys? When you bring that to the hospitals, the clinicians, the administrators, who can be kind of skeptical, like, that doesn't really apply, that's not us. How do you now quantify this information to help change the experience that is happening?
Yeah, and so in our analysis, we really only look at patterns, right? If there is a one-off negative review, that likely won't even come up for us in our analysis. So we're really looking at patterns. Earth also has a structured review process, so it's not a free-form commenting space. You're being asked very specific questions down to what happened to you, right? We have two screens on negative practice behaviors, which includes, were you yelled at? Were your pain levels dismissed? Did you receive poor eye contact? From the nuance to things that can be more pronounced. So we really want to use Earth as an early warning detection system so that we can prevent adverse events by looking for patterns of some of the things that we know lead to harm, that lead to these negative outcomes, right? When we see that there's a frequent reporting of pain levels being dismissed, and we know that in pretty much every maternal death story, someone's pain levels are being dismissed, a hospital should know ahead of time that this is happening in frequency within their facility. And so we can bring this data back right now in our national big database. The #1 negative experience being reported in Earth is my request for help were ignored or refused, right? Request for help were ignored or refused, a very specific tick mark that you can make within the Earth app. #2, the second most reported negative experiences, I was scolded, yelled at, or threatened. #3, my pain levels were dismissed. And #4, I experienced rude comments related to stereotyping, right? Too many Black and brown people feeling like they're coerced into contraceptives while they're actively birthing, people being asked about their WIC status, their their marital status, things that really have nothing to do with delivering a baby. And so the ways that we can lift up these qualitative experiences really helps us inform what else the hospital can do to achieve respectful and equitable care.
I was on mute. So this information really does help us collect the data and really improve the outcomes. I just want to ask you, I know that we're talking specifically about Black and brown births, but if I was someone of a different ethnicity and I came upon Earth and I had any type of experience, would it prohibit me from filling it out, or is my data also captured if that also shows a trend in care?
Absolutely. Everyone can leave a review in Earth, and so we accept all reviews. We also have a number of reviews from white women who have actually come in to leave reviews about things they have observed, right? They have been in a room with a Black or brown person and they saw disparate treatment, and they came to Earth to leave a review about what they saw. And so what I love is Earth also a tool for allyship in the ways that white women, and particularly even white doulas who see distinctions in care amongst their clients, are using Earth to be a tool for allyship, to be a voice, and to speak up for the folks that they know are being currently disproportionately harmed. So all reviews are important, and we certainly appreciate the ways that Earth is being used as a tool for allyship as well.
Excellent, excellent. And Kimberly, are you getting any five-star comments? Because the narrative that we're hearing quite a bit, and I'm sure that Earth and patient experience surveys getting qualitative information will be able to change, is the narrative that Black and brown joy, birth, happiness is adjacent to pain and suffering. So are you getting five-star reviews and people treated well? And is that also part of what Earth is collecting?
Absolutely. Many people come to Earth because they've had a great experience and they want everybody to know about it, right? You know, when people have had a good experience knowing, as you mentioned, the narrative that exists, they really want to inform and protect their community and say, I had a great experience here. And when we do our analysis, we always start with the five-star reviews. What went well, right? And how do we use that to inform and create what can be learnings for the field, what can be learnings for your state, what can be learnings nationally for what compensate, like what creates a five-star experience. So we always start with five-star reviews. That is our goal for every birthing person, for us to learn from that, and that could be something that learnings we give to the field that we can help others achieve that. But so many people want folks to know about where they had a good experience, and we're grateful for those contributions. And now we have reviews from over 48 states. You know, our reviews are in the tens of thousands, and so we're excited about the momentum and the possibility of using this robust mechanism to help inform what's happening on the QI side and other hospital improvement efforts around equitable maternal care.
Absolutely. I think this is a great way to help change the paradigm, the patient experience. Having that information is a tool that we have in our toolbox to really change the narrative. So, Linda, I know that you were really directly involved in the creation of the MAP. So what points from the plan do you think would make the biggest impact as it relates to data collection?
Well, there's just a couple of things that I have time to mention right now. One is increase in transparency and accountability. So there are some specific areas to look at how we increase transparency. Some data is collected currently that is not shared. And then getting away from silos. So moving to make sure that all of the different organizations and people and efforts in the state are coordinated so that we have the best outcomes. And then utilizing information from patient experience to add that depth. We all know that a story makes us respond in a very different way than numbers on a page. So the problem with just data and data collection and statistics is it tells us what, but not how. It doesn't give us that background of now what do we do with these numbers? What is it that needs to be done? So it gives us the information, but it doesn't tell us what to do and how to do it. And that's where the patient experience can enrich the numbers and the data that we have and give us different kind of data, a more in-depth data that is more in line with the experiences of Black and Brown people in our state to move the needle.
Using the information we have, the experiences we have, to really look at the person holistically and not into different little parts. Unfortunately, this all the time that we have today. I can talk to you ladies forever. Thank you so much, Kimberly and Linda, for joining me today. I really urge all of you to go to the New Jersey Healthcare Quality Institute's MAP, Maternal Action Plan, which can be found on their website. And you can also find it on the link below. And really think about and consider how you can help become an advocate for change. Look at what is happening around you and what we can do together to really ensure safe births for all of the people of New Jersey. Thank you so much for your time, and I look forward to seeing you soon.
Thanks again.
Thank you, ladies.